How is your family coping? The Ontario Parent Survey wants to know. They are back with a follow-up. Andrea Gonzalez from McMaster University is the study's lead researcher. Thanks for joining us today. So when you had the first survey done, or the first study done last year, did you think that was kind of a one-off during the pandemic and we'll see how things go?
Yeah, thanks for having me, Annette. We certainly were trying to act quickly, knowing that the pandemic was, an unprecedented time in families' lives, and our findings were quite extraordinary in terms of how people were functioning during the initial period. But I have to be honest, I didn't think that a year later we would be in this position again, which is why we are now launching the second survey almost a year to the day that the first one was launched, because we've now been through 3 waves and lockdowns and are currently in this new lockdown. So really to see how families are coping after a whole year of this sort of roller coaster ride.
Right. What did the first survey really show?
Yeah, the first survey showed that parents were really struggling. They had remarkably high levels of depressive symptoms. So about 57% of our respondents were experiencing high levels of depressive symptoms. A third were reporting moderate to high levels of anxiety. Parents were reporting that 40% of their children were faring worse off in terms of their mood and behavior. So it was all these really kind of concerning statistics. And, a year later, now we're just wondering how families are doing and how children are doing. And this new survey focuses a lot more on how children are doing and the types of services that people have either been accessing or perhaps not accessing, or what families are going to need as we now move on and hopefully out of the pandemic.
Right. Hopefully, yeah, hopefully there's not a third one that you have to do. But the information from this survey, it kind of shows where a need is needed, or maybe where something that is in place now maybe doesn't work.
Yeah, exactly. So we had some questions about what families needed and what kinds of resources they felt they needed, and we've held a lot of meetings subsequent to publishing the findings with key stakeholders in the fields of public health and social services, and they were some of the driving voices behind the new survey, and asking more specific questions about what do families need, and if they have access services, have they found it helpful? And if they haven't, what were some of the barriers and what needs to be sort of being provided to families in terms of services and programs moving forward?
Mm-hmm. So this is the survey is on for 6 weeks, and we'll get the link up at our website, chch.com, on how you can take this. Was there anything as a lead researcher for you that really, really stood out from the last one?
Yeah, I think that the high levels of depressive symptoms was quite striking. These are statistics you don't normally see in any kind of epidemiological studies. 57% is very, very high. And we went back to the data a number of times because we just wanted to make sure we were triple checking everything.
Exactly.
So that was certainly one of the concerns. And knowing that families are all home together, and the kind of impact that it trickles down if caregivers are feeling stressed and parents are feeling stressed, the impact that subsequently has on children as well.
Okay. Andrea, thanks very much for sharing this with us, and we'll, again, hope that more people take this survey. Very, very important results for it. Thanks for sharing it with us. chch.com is where we'll have a link to it.
Okay, great. Thanks so much.